We don't know why somebody dies by suicide. We don't know that. The research tells us there's a lot of information of factors leading up to somebody having suicidal thoughts, such as someone feeling hopeless, feeling down. There's a lot of isolation. There's increase in risk-taking behaviors such as drug and alcohol use, giving away possessions. For teens, there can be something humiliating happen to them, a breakup, something on social media. Somebody may post something concerning on social media, so it's all those warning signs to look for. And they may be thinking more about dying or researching ways to die. People who have depression, it can feel like the hardest thing in the world to get out of bed and to go do that and to gauge what's going on. One thing that is new to the mental health is to help recognize what we physically feel like. If we physically feel like we have no energy, if we physically feel like we're just and just feeling really heavy, well, that's actually signs of depression. Sometimes in males it comes out as anger. And if we feel really angry more than normal, well, that could be depression. And it's helping people understand what our actual physical symptoms are as well, because sometimes it is hard to know. And you can call your primary doctor, you could call the crisis line, you could call the 988 number, you could call the Text for Life, something to reach out of, I'm not feeling okay, something's off. Mental health does not discriminate, and people do not have to be embarrassed. It can happen. People can have emotional turmoil, whether they are 90, whether they're 9, whether they're, running a church or a school, whether they're, somebody who's trying to figure out how to find a job and how to find a house. It doesn't matter. Mental health is across the board for all people, and sometimes life can be really hard, and we need the extra help and extra support of someone talking to someone and someone listening. Getting help for people sometimes can be really overwhelming, and the thought of it can be scary. However, people who have come to therapy have said it feels so good to finally say something to someone. So sometimes it can be hard and be a little uncomfortable, but once we get the words out and whatever we're talking about out, there's a sense of relief. If a person notices that one of their friends, family, whomever is not themselves, you can ask. And there's a myth out there that if we ask somebody if they're having suicidal thoughts, they're going to become suicidal, but that's not true. So you can ask somebody, are you okay? Are you having thoughts of hurting yourself? Are you having thoughts of dying? Because we want to know, and then we can get the person help so they can talk to someone. If your friend or loved one, coworker, whomever says they're having suicidal thoughts, you can call the crisis line in Becker County, which is 850-HELP, and you can call on behalf of a person because you're concerned with them. And our crisis line practitioners will call and talk with the person and come be with them. We can meet them in person, we can go to the jail, we can go to the emergency room, and so that person is not alone and stuck in their thoughts. Resources that are available for someone would include crisis stabilization, which would help somebody with the skills to help manage the emotional distress that is going on for them. And we often learn our skills for managing this from the time we were little, and then as we grow, our needs change, and so our skills need to change. So it's okay to learn new skills when we're having emotional distress, that what worked when we were 10 probably doesn't work now when we're 40. So when the crisis team member shows up, or they're on the phone or doing a Zoom call, whatever it is, you can stay with them and you can ask them, do you want me to stay with you? Or do you want, what would you like me to do? You can ask the person, and our crisis staff is very well trained, and they will know the crisis assessments can take anywhere from 2 to 4 or 5 hours. They make sure they're very thorough so that the person has a safety plan, or do they need a higher level of care? Or do they need resources? What is it that that person needs? And we make sure that that happens. A safety plan is helping the person figure out who and what resources they have to use, so that if they are feeling alone, if they are feeling down, if they're feeling really anxious, if they have this, big thing in life that they're going through, or a little thing that seems like a big thing, whatever, they have steps that they can take to help get through the issue of whatever's going on. So it's recognizing, what's going on inside of us. What are some strategies we can use, whether it's be going for a walk, whether it's calling a friend, going to get something to eat, something to distract ourselves so we don't stay in the thought of what is emotionally causing us, angst at the time. So if somebody does not want to call, we could give them the resource, but stay with them. Maybe in just staying with them, having the conversation, you could bring them to the emergency department as well. Maybe that would be more comfortable. Sometimes people, when they call the crisis line, they don't want their family and friends contacted, which is okay. So then, and there's also the 988 number, the nationwide number that they can call as well. We have a county-wide crisis line, and our crisis line is manned 24 hours a day, 7 days a week. A live person answers the phone that we can call, and the person, if a person's feeling down, they may not want to reach out to family and friends. They may not want to call someone, so a family and friend could also call on their behalf. If a person's noticing that they're feeling off, if they're feeling like I haven't seen anybody, I'm feeling alone, they could call the crisis line for help.
This video is brought to you in part by Stellher Human Services, mental health services for children and adults.